All right, so I am recording, and I'll get going in a little bit, and hopefully Priscilla will kind of come in a little bit. I'm going to record this, and I will post it relatively soon. But before we start, I need to get share screen. Okay. Not sharing, I'm presenting. So welcome, this is Kappblogs number 31. And what are the prevailing investing in this year? And so this is the SFPDA student chapter, SFPDASC, an affiliate of the West Coast Chapter Parenteral Drug Association, connecting people, science, and regulation. And again, this is the student chapter, and what I just wanted to say is that the majority of life science investments for the coming year are going to be in emerging tech, according to a conference survey. And so the conference that I'm talking about is R&D World, and R&D World is a kind of an online can somebody send Priscilla the link? Oh, there she is.
I believe.
All right, so I'll have to chop this out. So that's okay. I'll go up. So R&D World is a journal that's free, that you could order it online, and they cover everything from aerospace to semiconductors, with in between it being biotech and pharma. And so this free magazine that looks at research and development, if you've noticed that a lot of the research and development that we have has kind of overlapping materials, and so they make their money by selling advertisements for various materials. Today, I am Nick Kapp, your SFPDASC academic advisor. Maria de Aguilar is our president and editor of this fine podcast. This is a weekly series of podcasts, roughly about 5 to 10 minutes long. What we intend to do is inform and educate a new generation of pharma manufacturers through a discussion of helpful links, stories, and interviews. This gets better the more that the student interacts. And so we have a number of students in here that will be talking with us today and giving us some feedback on this. And so again, along with R&D World, we're talking about a group called the Pistola Alliance. And this is Pistola, I believe, Italy. And so what they do is they realize that advances and breakthroughs in science can't be achieved by the single person working in their lab, can't be achieved by a single area, biopharma, biotechnology, biology, or chemistry. It's what we really need to do is to lower the barriers for R&D innovation by providing the legal framework to enable straightforward and secure pre-competitive collaboration between more than 100 global members. And so you have very large organizations that are working to this. And basically what it is that a lot of times you don't really do innovative stuff by just kind of working by yourself. It's only by working and interacting with other people that you develop this. And so the Pistola Alliance, what they wanted to do is to basically bring people together so that we understand this a little bit more. I haven't seen a lot of examples of this yet in drug research. Maybe we'll get something in the future. But one of the examples that I get for pre-competitive collaboration is by basically computing. So this kind of online very efficient computing. And what we see is and also databases. And so FAIR, which is findable, accessible, interoperable, reusable, guiding principles to data management and stewardship. And so this FAIR organization came about by a number of people who are working on this. and I don't know, but I suspect there's a number of life sciences, especially with the data that we're generating for genomics. What we're seeing is in bioinformatics, we're really seeing that people working on their own computers really can do that. And so what we need to do is kind of share this information. I am a big fan of FAIR, findable, accessible, interoperable, usable, because I'm hoping that this will make our research more reproducible. If you let people know exactly how you do something, and then they are hopefully going to be able to find it. So again, this group, the R&D group, surveyed their members, large and small pharma, and came to the conclusion that the following will be funded. AI and blockchain will get about 38% of the fundings. Infectious diseases will get about 32% of the fundings, and oncology will get about 14. So we're talking about life science here. We're not talking about all R&D. We're just basically talking about life sciences. And so what is IA? IA is artificial intelligence. IA systems demonstrate at least some of the following behaviors that are associated with human intelligence. And what we see is, can we get machines that will do something a lot like what we do? And again, we call it AI when a machine is able to do the planning, the learning, the reasoning, the problem solving, the knowledge representation, perception, motion, manipulation, and to a lesser extent, the social intelligence and creativity that we can do. Okay. So again, your assistant, your Google that you have on your chart, your Alexa, those are able to use a relatively narrow band of artificial intelligence. And so if we were to open this up and do broadband, we would have artificial intelligence doing stuff like doing diagnostics, helping us with our research in our laboratory. And so again, do we know how to do this? No, it's science fiction. But again, if we understand and we research this a little bit more, hopefully we'll be able to look at it. The next thing that we're looking at is blockchain. I'm thinking of Charlie Brown. Hey, you blockhead. But basically what's going on with blockchain, well, let's go on this. I have a graphic up here. But basically, your data is distributed across several blocks. It's in servers kind of all over the place that have the same one. Tampering is really difficult because you can't work with all servers at the same time. The transactions are easy to trace. And in healthcare, this allows for several stakeholders from different silos, including providers, payers, and pharmacies, to have access to the data. So it's almost impossible. So right now, if you get a drug, you can actually probably, if you want to make a drug and like something like this, something like an inhaler or something like that, you can make a fake copy of it. And again, if you can get the lot numbers and stuff like that, you can maybe do this. And so the idea is that through blockchain, we will have information and know exactly where our materials are. And so it would make it almost impossible for somebody to actually create artificial or actually fake drugs in order to put out. The next thing that people are really looking at, and it's obvious, healthcare with the COVID, is that infectious diseases. And what are infectious diseases? Basically, these are kind of new diseases that you can catch from somebody who has it in the environment. And what I would like to just say is that, this is basically from the news here. This is, I took this 2 hours ago. This is Friday, the 21st of May, 2021. And here's this new coronavirus found, and it jumped from dogs to people. And so, quite frankly, we've been getting coronaviruses jumping into our populations for a while now. And, and again, unless these things kill a lot of people, and 1% is a lot, but it's not that much. Unless it really kills a lot of people, we probably wouldn't notice before. Again, before we had the tools, the DNA and electron micrographs, in order to study these things a little bit more, hey, we may have thought it was kind of a bad flu year. And so what we're seeing is we're getting a lot better at diagnosing infectious diseases, and these infectious diseases are popping into our population all the time. So, why don't we make a vaccine rather than a vaccine working against one coronavirus, the COVID-19? Why don't we get a vaccine that works against all coronavirus? So that way we don't have to worry about, as the coronavirus evolves or as a new coronavirus jumps into our population, can we have a vaccine for that, or can we produce an actual cure for that as well? The third part about life science R&D is basically going to be looking at oncology. Kind of the same thing. If we look at that, we're actually getting better at treating cancer. And if we look at the death rate of cancer, and so this is per 100,000 people, in 1999, we had roughly about 250 people out of 100,000 people die of cancer every year. And that number has gone down to below 200. The purple line that we have here is the goal that we would like to have for people. So we've already made that goal by 2030, but actually we want to do it by 2030, and that's actually I think 2021, or we've already done that for females. And so what we see is that we are getting better. Why are we spending more money on these kind of things? It's because we are getting results. Cancer is a bad thing, but again, we are finding results. We are finding cures for cancer, and hopefully we will, this money that we spend on cancer cures will be well spent. The group that I'm talking about, the Pistola group, also predicted that actually biotech startups would be responsible for basically the majority of innovation. And so we see that big pharma will be roughly responsible for about 18% of the innovation. And then the biotech startups would be about 40%. The rest of it is probably academic institutions. And so if you really want to be innovative, you want to go to those small companies. You want to work with those small companies and get that blockbuster. And so Steve Arlington talks about it, who is the president of Pistola Alliance, says, now more than ever, research is occurring at the intersection between industries. So you don't know just one industry or another. It's helpful to kind of have your foot in several industries. Companies must embrace this trend and work together to tackle future challenges. We must advance quickly from disease treatment to disease cure, and finally to disease prevention. And so again, we're starting to treat diseases. We are starting to cure diseases, but what we want to try and do in the future is to prevent those diseases from happening. And so where is this going to happen? It's going to happen in your labs. And so the next thing that we want to talk about is the lab of the future, LOTF, right? And so the lab of the future was also discussed at this conference, and 3/4 of the people surveyed think that the lab of the future will be 50% virtual, or more by 2030. And this underlies the shift that we are seeing in hybrid work across all industries. And so when we look at industries, the lab of the future is going to be sustainable. The lab of the future is going to have some artificial intelligence, and the lab of the future is going to be connected. And so what I really want to see the lab of the future is Tony Stark's here. This is from the Iron Man movie. I want this particular lab, where again, we're connected with other people. We have artificial intelligence that's working for us. We may be responsible or do a little bit of the hands-on work, but you know what? We have robots and artificial intelligence to do that. Again, who's going to develop this? Who's going to pay for it? We don't know. So where are we going to work in the future? You guys have any ideas? What's your lab of the future going to be?
My idea of the lab for the future is going to be more automation involved. So many stuff that has a lot that was like done by technicians' hands, which have more prone to error. I think we have developed more sophisticated automation machines or instruments that can do the same thing humans do, except more precise and more efficiently.
So relatively cheap robots that you would have in there that would be able to do that stuff. Tram, what do you think about a lab for the future?
Hello?
Yeah, I can hear you.
I'm not sure. Using robots. Like, how about using artificial intelligence, something learning for making prediction, simulation.
Yeah, I'm old. I don't want to use artificial intelligence. I want to use mine, but I'm old. You can use it.
Yeah, so robotic, I'm not sure. But I think that would be efficient, because that means we will have more time to do the designing for experiment analysis for it instead of doing dishwashing.
Or pipetting, or
Yeah,
or
yeah,
setting up a 96 well plate assay where you're pipetting the same thing 96 times.
yeah. But that means lab will be more about using your brain rather than using your hand, which is like kind of less experiential, in my opinion, which means less fun, I guess.
Less experiential, less fun. Yeah, that's true.
And I don't know. I think like something hands-on would be also helpful for the mind too. So maybe using robot for what they call 3D, dirty, dull, and the last one I don't remember. Um, so those dirty, dull, and dangerous. So for tasks that are quite risky for humans, using a robot would be beneficial. But I think we should still, well, in my opinion, it would be it would be I would say good to I don't know what's the right word, but I think it would be valuable if we keep a part of the lab hands-on, because the experiential part is valuable to me. I think.
Yeah. But isn't it, so you're using a tool to do a lot of this stuff anyways. Isn't dealing with the robot, isn't that experiential?
It depends. Like, how do we use the robot? What are we creating? If it's something that can really take human to Mars, something like that, that would be cool. But if it is like Frankenstein thing,
It's like Frankenstein. So you're the technology that runs amok through the town and kills everyone is not good. Okay.
yeah. I mean, it comes with ethics when it comes to robot use, right?
Yeah.
I heard before. Yeah.
Priscilla, can you join us? What do you think about the lab of the future? What do you want the lab of the future to be?
Oh man, I don't know. It's it's a very open-ended or very in the future type of question. Because I
Yeah.
mean, even now having instruments that need people to be able to function, and then adding automation to do all these simple tasks. And yes, you do need people to be able to attend those instruments and take care of them and whatnot. So it becomes more of a what's it called, more of a maintenance for instruments than research.
Well, do you consider you work
Unless,
with one of those pieces of equipment, right? So you work with a
yes,
flow cytometer. Do you
yes.
feel that you're more just that you maintain the equipment? Do you feel that you're more of a robot maintainer, or do you feel more like you're a biologist, or both?
This level, since I'm a beginner,
Uh-huh.
I'm more of a on the maintenance side. I'm on the maintenance side because I need to be able to troubleshoot and solve the issues that the users have and whatnot, compared to running it myself, or at least often, because that does not come often, if that makes sense.
Yeah. So
Yeah, so
to become a journeyman on that, you have to put in your time.
correct. Yeah, but then again, it's good to understand how the instrument works so you can run it and be able to solve the issues that come along as you are running.
Yeah.
So it's one of those. But then again, you need somebody to be doing something, research to use the technology, to be able to use the technology, as well as what is it called? Wow, I lost it. I lost my train of thought. But it's just the science part, it's not. Oh, yes, I got it. It's more of if you are running the instrument, sometimes you're not really doing the science. You're just
Yeah.
helping the scientist, unless the title changes. And it's more of the facility runs everything, and you're just there to pick up the samples of whatever you're running. It's like I forgot the name of it, but it's more on that regards. But me doing the science or that kind of stuff, not at the moment. Also, I will need.
But you're learning. And you will
Yes.
be in the future.
Yes, I'm learning it. It's more of the troubleshooting for the experiment itself, not really coming out with the idea of like, oh, what happens if we do this? Like, no, we just run it. There's not a lot of research in regard. If there is research, it's because we are helping somebody helping the design of the panel to be able to run something that will give results and not a lot of overlapping or complications and whatnot in regards to the lasers and fluorescence and spills and everything that comes to play. But again, not on the trying to discover something or trying to figure out something. Like that's not part of the title. That's
Okay.
something else.
So anyone else thoughts on lab of the future? What are we going to do in labs in the future? Not showing up. If I say robot, give me a clone, give me a XY clone, that would be wonderful.
Yes, that will be wonderful.
But we're not there exactly yet.
No, I mean we are at the point where we can tell the robot to do a certain job, but then we need people to be able to manage that job and that robot so the job can be done, or if there's something going on. So it becomes more of an engineer. Well, not an engineer, but that type. I don't know if there's a name, but it's more of a babysitter to the robot than doing the job.
A technician.
Yes, a technician.
Okay. Or a high paid babysitter.
Exactly, which is always nice, but it's not really on the getting your hands dirty trying to figure out something. It's more of, oh, let's see, you seem jammed, let's try to figure you out, and if nothing happens or you cannot do that, then you need to call the engineer, like the big guns, to solve the problem.
Yeah.
But yeah, so
All right, you guys, let's close this on out. So tell me, is this politics or is this science?
both.
I'm going to try and do that as a tagline.
It is both for sure.
It is both for sure. All right, thanks for tuning in at Kappblogs at SFPDSC. We are on LinkedIn, Instagram, Facebook, and Twitter. So see you next week. Does anyone have an idea what we should talk about next week?
Next week. Yeah, I mean, to unmask or not to unmask, but it's just